Do you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast, dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
Welcome to GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I am your host, Alyssa Jo. Hello, everybody. How is it going today? I hope you're having a wonderful day and that you've been having a wonderful week. If you're listening to this on the day that it comes out, happy weekend, happy Saturday. I hope you're feeling good. I am feeling good. I am just been in a good mood lately. Things are going well, and one of my favorite parts about my routines these days is that I get to research and share all this information with you guys on how to improve your overall health and wellness. This subject is so important to me. I have really, in the past few years, been diving into how I can improve my overall health and wellness, especially with my mental health, my physical health, emotional health, spiritual health, everything that kind of comes into it. So it just makes me so happy that I get to come on here and share all this awesome information with you guys to hopefully help you improve your overall health and wellness. There's just so much to talk about under this subject, and it's so exciting because every single week I get to pick a new subject that I feel passionate about, and I get to learn more. I get to bring in the information I already know, and then I get to do research and really dive deep into these interesting topics that I think are so important for people to be educated on and to be aware of, because so many things that I think are talked about on this podcast are very common, more common than we think with a lot of people, and sometimes we don't let these thoughts come to our head, or we don't really address or really dive deep into these topics because maybe it's not prominent in your life, or maybe you don't think it's prominent in your life, but it is. And it's just really cool to be able to kind of learn about how we can, of course, improve our overall wellness, because that's what life's all about. We want to be healthy and well and live a good, healthy, happy life, right? So I'm super excited to be here again, as I am every single week, and I'm going to jump right into today's episode because I have so much information to cover over this hour that I am with you guys today. As you can see by the title, we're going to be talking all about ADHD. ADHD is a mental health disorder. I will dive into that in a second here, but this topic is really important to me, and I think a lot of people might find this helpful because ADHD is common in children and in adults. A lot of adults aren't diagnosed until later on, and I think some of the things that I will talk about in today's episode might be like, hey, I can relate to that, or hey, maybe that's why I do this. And I'm no doctor, I can't give you a diagnosis, but I can just relay the information that I have studied to you, and it just might kind of put a light bulb in your head. I can do, that's why I do this. There are a lot of behaviors or things that we do as children, as adults, just humans in general, that we don't really have the answer to. Like, why do I do that? And maybe some of the topics that I talk about in today's episode will help you come to realization of these things. So I'm going to talk all about ADHD today. I'm going to talk about what exactly it is, what causes ADHD. I'm going to talk about the symptoms. I'm going to dive deep into the 3 types of ADHD, because there are 3 different types that you can be diagnosed with. I'm going to talk about ADD versus ADHD, because you might have heard of ADD before and maybe not heard of ADHD. So I'll dive into a little bit of that. And then I'm going to talk about adult ADHD versus child ADHD. So whether, you might have a child that struggles with ADHD, or you might not even realize that they have ADHD until you listen to some of the things I'm going to say today. But anyways, I hope this is super helpful. I hope it is going to help you improve your overall health and wellness. And I'm super excited to talk about this subject today. I absolutely loved researching and learning more about it. So lots to cover. Let's jump right into it. So what exactly is ADHD? So ADHD stands for Attention Deficit Hyperactivity Disorder. This is a mental health disorder that can basically cause above normal levels of hyperactive and impulsive behaviors. So people with ADHD, they usually have trouble focusing their attention on a single task. They might have trouble sitting still for long periods of time. I will jump into some more symptoms, but just to kind of give you a base there. And ADHD is a neurodevelopmental disorder. Okay, so it's most common in children and adolescents. And neurobehavioral means that they're both neurological and behavioral components to the disorder. So there's so much information and that kind of comes into this. So that's why I say I have so much information to cover for you today. Now that you kind of have a gist of what ADHD is, what it stands for, let's dive deeper and what causes ADHD. Well, that is still very unclear, okay? So scientists say that it's due in large part to genes that are passed down from parent to child, so it is usually genetic, but experts aren't really sure yet which specific genes make it more likely to get ADHD. It's been around for a long time, but there's still so much information coming out about it and new information and different things. So, but a child is more likely to have ADHD if a close family member has it. And it's not completely known what causes it in general, but there are a few studies that I want to share with you. And one study of twins and triplets suggests that there is a genetic link. Then there was a review of a bunch of studies that happened in 2016 that noted that exposure to lead paint in childhood may increase the risk of developing ADHD. There was a Norwegian study back in 2017 of more than 94,000 women found a causal association between alcohol use during pregnancy and ADHD symptoms in their children. So there's kind of a bunch of different studies, lots of different things but nothing is completely clear. Scientists do continue to explore the relationship between brain injury and ADHD, which is quite complicated. But some other possible causes of ADHD could include exposure to drugs, nicotine, a low birth weight, premature birth, nutritional things, so such as food additives. And many parents especially claim that sugar makes their child hyperactive. But there is actually no evidence that that says that refined sugars causes ADHD or even makes it worse. Of course, there's that sugar high, that sugar rush where your child might be running around in circles, but that doesn't mean that it's going to cause ADHD or make it any worse if your child already has ADHD. So, some general symptoms. There's a wide range of behaviors that are usually associated with ADHD, but some of the most common ones are having trouble focusing or concentrating on tasks, being forgetful about completing tasks, or just being forgetful in general. Some people with ADHD will lose things really easily, just misplacing them, whether they're important or not important things. That can be a common symptom as well. Being easily distracted, having difficulty sitting still, and interrupting people while they're talking. So having a hard time waiting your turn and needing to be impulsive and blurt out, right? That's part of the definition in itself. So this diagnosis of ADHD is recognized by the APA, so the American Psychiatric Association. And when this was recognized, they wanted to make the diagnosis more consistent. So they grouped the condition into 3 different types or categories, if you will. But before I jump into the 3 types of ADHD, I want to clarify the difference between ADD and ADHD. So ADD, which is Attention Deficit Disorder, and then you have ADHD, which is Attention Deficit Hyperactivity Disorder, very similar, okay? And so you may have heard the term ADD, and then ADHD kind of used interchangeably, especially within the past 3 decades. You might hear some people say, oh yeah, I have ADD, or do I have ADHD? And it's kind of interchangeable. So basically, what I could tell you is that ADD is ADHD. Basically, attention deficit disorder is now grouped into one of the 3 types of ADHD, and so you don't really have to worry about ADD. That's not a term that's really used anymore. It's just been kind of had several name changes through the different research and things that have come out, but now it's known as ADHD. And this is over the past 3 decades that this kind of the name has been interchangeable, but now you will hear most commonly ADHD, which covers all the things of ADD. So I will get into that. So there are 3 different types of ADHD, like I mentioned. There's predominantly inattentive, there is hyperactive impulsive, and then there's a combination type, which is obviously a combination of those hyperactive impulsive and dominantly attentive. Okay, so let's dive deep into the first one here, predominantly inattentive. So the inattentive type of ADHD isn't what most people picture when they think of someone who's hyperactive. People who have the inattentive type, they're usually less disruptive. They're usually less active than those who have the predominantly hyperactive impulsive type. But people with this type of ADHD have extreme difficulty focusing, finishing tasks, and following instructions. So there are some specific symptoms that come with predominantly inattentive ADHD, which are missing details and becoming distracted easily, trouble focusing on the task at hand, becoming bored very quickly, difficulty learning or organizing new information, trouble completing homework or losing items needed to stay on task, becoming easily confused or daydreaming really frequently, seemingly to not listen when spoken to directly, difficulty following instructions, and processing information more slowly and with more mistakes than others. So experts also think that many children with inattentive type of ADHD may not receive a proper diagnosis because they don't tend to disrupt the classroom. So it's kind of, when you think of ADHD, you're thinking of that impulsive kind of disrupting, can't sit still. But with this first type, they're not always going to be that disruptive. So this is where the kind of common misdiagnosis might come from. But inattentive ADHD is actually most common amongst girls with ADHD. That's kind of where it falls in the most, which men and women can all get ADHD, but it's just the research has shown that it is most common with girls to have predominantly inattentive ADHD. So what does the diagnosis kind of consist of when it comes to this? And a doctor will observe your behavior to diagnose you with this ADHD, of course. You have to show at least 6 of the 9 symptoms to be diagnosed. Now, that varies from children to adults, which I'll dive into a little bit later on in the episode. But you have to have a select amount. You have to meet the criteria of these symptoms to be diagnosed. And your symptoms must be severe enough that they stop you from completing everyday tasks and your activities. So your doctor will probably also do a medical exam to rule out other possible causes. But the reason why these symptoms have to be severe is because it is very common for us to as humans, to just get distracted, to become bored, to daydream, or to not be paying attention as well. Like, that can happen in our everyday lives. Doesn't mean that you have ADHD, but these symptoms need to be severe to get that diagnosis. Now, when it comes to treatments, the treatment plan will look different for everybody, and there's so much information to share about this, but we got to take a break. So when I get back from the break, I will dive deeper into the treatments of the predominantly inattentive ADHD type. I will talk about the medication, the therapy that you can do for it, and then I will move on to the next one, which is hyperactive impulsive type. I'll talk all about that, the combination type, and basically give you a whole gist of what ADHD is in general. But definitely stick around to the end because I'm going to be comparing the difference between children with ADHD and adults with ADHD because there are different treatments and diagnosis that might play a role in it. So you don't want to miss any of this information. I will be right back.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
Welcome back to GSMC Health and Wellness Podcast. I am your host, Alyssa Jo. Hello. Okay, back from the break. We're talking all about ADHD today, and specifically right now we're talking about the first type of ADHD, which is predominantly inattentive. So I went over some symptoms, I went over a diagnosis, now let's talk about the treatment. And like I mentioned before the break, treatment plans can and will look different for everybody. As some things, of course, they'll work better for some people than will work for others. But there are some basics that I can kind of share with you that will be generalized in your treatment plan or your children's treatment plan. So medication and behavior therapy can improve the functioning of people with inattentive form of ADHD. And some people only use medication. Others may just rely solely on behavioral therapy and some lifestyle adaptations. But some people or most people end up using both medication and behavioral therapy to manage their symptoms. So when it comes to medication, stimulants are the most common type of drug that's used to treat inattentive type of ADHD. Basically, a stimulant helps your brain focus, right? So it's important to know that medications don't cure ADHD. There's actually no cure for ADHD, but medications and behavioral therapy can help manage and reduce those symptoms. So some of the stimulants that you might get prescribed if you have ADHD, things like Adderall, Vyvanse, Ritalin are common medications to treat this disorder. They have a long-lasting versions of these medications, so that means that it can help the person get through their entire school or work day or whatever they need to do. So it just depends on what's going to work best for you. And medication is proven to help you concentrate, but it has not been proven to help you plan and organize, right? And having difficulty planning and organizing things is definitely a strong symptom in inattentive type of ADHD, but a lot of people find that if they are able to concentrate, they're able to plan better anyways, right? And so it just depends what works for you and how bad your symptoms are, what's severe for you and what isn't so severe. But people with ADHD, they usually need help with their skills, such as, getting organized or how to plan and follow through with plans. And then this is really where that behavior therapy comes in now that I want to talk about. So behavioral therapy is another type of treatment. It's also called as behavioral intervention. Basically, it helps the parents, the teachers, or yourself, if you're an adult with ADHD, to build strategies that you can use to create structure and routine, because when you have predominantly inattentive type of ADHD, you need structure, you need routine. That is going to help the most to kind of get your brain focusing on what you need to be doing, the task at hand, right? So there's lots of different behavioral therapy that you might learn or get introduced to, but basically it just helps you function at work, at school, at home, at all different areas in your life. And getting rid of distractions and unpredictability is a really strong key factor in leading a successful life with inattentive type ADHD. You really want to try to limit those distractions as much as possible, and you want to have a plan. You want to be organized, because kind of that unpredictability factor can really throw somebody with inattentive type of ADHD off, and that can cause you to get anxiety and feel really down and just not be able to focus and not be present in your day. So creating a routine and sticking to it is very, very, very beneficial. Turning off televisions, radios, or other electronic devices when you are doing your work or your homework, just to cut down on any type of distraction that you can. So that's kind of the gist of inattentive type of ADHD. Now I want to talk about the second type here, which is hyperactive impulsive type. Now, people with this type of ADHD show primarily hyperactive and impulsive behavior. Hence kind of the name of the type, right? So this can include fidgeting, interrupting people while they're talking, like I mentioned before, not being able to wait your turn. Although inattention is less of a concern with this type of ADHD, people with predominantly hyperactive impulsive ADHD may still find it difficult to focus on tasks, but it's not as common with this type of ADHD. So some of the symptoms that the doctor will look for when they are going to be doing the diagnosis is the fidgeting or squirming, so just not being able to sit still, nonstop talking, trouble sitting still and doing quiet tasks, so reading might be really difficult for you. You might be running from place to place, kind of acting like they are just driven by a motor, right? It's like that energy, that hyperactive go, 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 go. Constantly leaving their seat or jumping or climbing on furniture or kind of other inappropriate places. This is obviously more common in children than adults, but you never know. Not having any patience for things, right? You want things done now and quickly. Blurting out comments at inappropriate times, that's that impulsive behavior, interrupting conversations or speaking out of turn, once again, that impulsive behavior, and trouble waiting for a turn or just trouble standing in line. You basically don't want to stand still with this type of ADHD. So the diagnosis, when it comes to this one, there's really no single test that can confirm whether you're a child or an adult has this type of ADHD. So basically, your doctor will first try to rule out other things that can cause hyperactivity. So this could be a stress or emotional issue. I find that, or through my research, I have found that doctors will be very specific when diagnosing ADHD, because there can always be underlying symptoms or things going on in your life that are making you have these things, that are making you being impulsive or not being able to sit still, or, you know, those kind of things, right? So there might be some stress, some emotional issues that need to be dealt with. So they'll really kind of try to examine those things for you. The behavior might simply be just appropriate for that age too. Like if you bring your child to the doctor because you think they might have ADHD, it might just be appropriate for their age. They might just be climbing on things and being extra energetic, just because that's, you know, what they do at that age. So they will really try to examine those things and think it all through. Sometimes vision problems or learning disabilities can make it hard for a child to sit still, right? So there might be all these underlying problems that are making these behaviors happen in somebody's life. So to meet this diagnosis, you have to meet that criteria of meeting 5 or 6 of the main symptoms. And once again, they have to be severe enough that they are affecting your everyday life. They are affecting things at your school, at your work, or your relationships, or just making it very difficult for you to function at a normal level. So there's the diagnosis and the symptoms of hyperactive impulsive type. Now, what is the treatment like for this type? It is pretty similar to what I mentioned before with the inattentive type. There's medication, and then of course there's behavioral therapy as well. But with the medication, it's a little bit different. You can use the stimulant drugs that I mentioned before, but there's also the option of the non-stimulant drugs because it's not always about staying focused and concentrating. With this one, you might be moving around too much, jumping like crazy, being impulsive more, right? So there are the options of the non-stimulant drugs, but they may not work as well as the stimulants. But these drugs usually have fewer side effects. So once again, every treatment plan is going to be different. You're going to have to discuss with your doctor of what exactly kind of this entails and what's going to work best for you or your child. Now, high blood pressure medicine is actually also an option that can help control impulsivity and hyperactive symptoms. So you just got to kind of weigh your options, see what's going to work best for you. Obviously, maybe this medication isn't good for your health otherwise, right? So you really want to weigh out all the options and talk to your doctor about it. So those are the basics from hyperactive impulsive type and the inattentive type of ADHD. Now, the most common type is a combination of these two, and that's what it's called. It's called the combination type of ADHD. It is the type that is seen the most in children and in adults because most people will display some sort of combination of both types of these symptoms, and then they will be ending up in this category. So the diagnosis for this type, of course, is to meet the criteria for a combination of these symptoms. You will have to meet a select amount. Children are different than adults. Children might only have to meet 5 of them, or adults might have to meet 6 or 7 of the symptoms to get this diagnosis. When it comes to treatments, though, it is also still relatively the same when it comes to the medication and behavioral therapy. So behavioral therapy, let me dive a little bit deeper into that for you. And the goal of this treatment is to really help change behavior. It's kind of stated in the name, right? So it teaches you or your child to strengthen good behaviors. So behavioral therapy can help a parent, a teacher, a therapist guide a child or an adult to learn positive behaviors. So behavior therapy may include parenting classes, class management, peer interventions, organizational training. Could be a combination of these therapies. You may also receive cognitive behavioral therapy, so CBT, and CBT teaches a person coping strategies to help modify unwanted behavior and help with mood and anxiety symptoms. So the thing with ADHD, it's very common to have other mental health disorders as well. So you might struggle with anxiety, you might struggle with depression, or any other kind of mental disorder, but those are really common because whether the ADHD is making you anxious or making you more depressed, or it could go the other way too, right? You might find that you were diagnosed with depression or anxiety first, and then you find out later, I have ADHD as well, and these kind of go hand in hand. So it's important to make sure that you're getting a proper diagnosis for everything because you want to be sure of the treatment that's going to work best for you. So CBT is really effective for adults with ADHD, which I will get into that a little bit later in the episode when I explain the difference between child and adults with ADHD, but these treatments need to be more specific and they need to be refined. Another option for behavioral therapy is family therapy. ADHD can also, of course, impact the relationships with parents, with your family members, especially before someone is diagnosed. diagnosed. So family therapy can help everyone to learn how to cope and manage a family member's symptoms of ADHD. It can also help with communication and family bonding as well, because most people with ADHD have communication problems. You will find when I talk about these symptoms in adults, the communication problems are very prominent, whereas children, we're still maybe trying to learn how to communicate better, so you might not see it as much. Of course, they will still have those communication problems, but family therapy can be very beneficial so that everybody understands what the coping strategies and the things that you can do and the proper things to say or not to say when it comes to somebody in your family that is struggling with ADHD. Now, like I said, ADHD, there is no cure, but these treatments with medicine and behavioral therapy can be very, very effective for people, and it can help them lead a very successful and happy life, okay? So it is time for another break, almost coming up here, but when I get back, I'm going to dive into children versus adults when it comes to ADHD. Now, there are quite a bit of differences, and I think dealing with a child that has ADHD, obviously there's a lot to it, and a child doesn't know how to handle themselves as well. But as a parent, if you have a child that is struggling with ADHD, there are things that you can do to help them to make their quality of life better, as well as make an adult's, as your quality of life better as well, right? Because it will affect everybody around that individual if the symptoms are very severe. And ADHD is very common in adults as well. You might not get diagnosed with ADHD until you're in your 20s or 30s or 40s even. And the thing is, though, with ADHD, you don't just develop it over time. If you have ADHD as an adult, it is very common, you would have had to have it as a child growing up as well, even if you weren't diagnosed back then. So I have so much information to kind of lay out the difference between children versus adults with ADHD. I will dive into the 3 different types specifically within those categories. And then I'm going to round off, of course, with just some more tips on how you can function better if you are somebody that has ADHD. So don't go anywhere. So much good information to be shared still. I will be right back.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter, and download us on iTunes, SoundCloud, and Google Play.
Welcome back to GSMC Health and Wellness Podcast, talking about ADHD today. If you're just jumping in to the episode halfway through, welcome. I talked all about exactly what ADHD is, the 3 different types of ADHD, and the symptoms, the causes, the treatments, all of that fun stuff. And now I want to dive really deep into the difference of ADHD in children and ADHD in adults. So let's talk about children first. Usually it's pretty easy to spot children with combined ADHD in a classroom setting because they might blurt out answers, they might fidget constantly, they might have just a hard time staying in one place. So students with ADHD in attentive type are harder to spot though, because instead of drawing attention by fidgeting and moving and blurting out answers, they're going to sit quietly at their desk. They might be just staring out the window, things like that, right? So often these children appear to be performing beneath their potential. But they're smart. These children are still very, very smart. They just struggle with organization and distraction. So homework might not always be completed or turned in on time. And when you aren't diving deep into a diagnosis, you might just think that this child is lazy, they don't care, they're just performing beneath their potential. They're just not trying is really what it comes down to, but there can be so much more to it. So many children who like to run and jump and may have really high energy, right? A lot of children do, right? Whether you're on a sugar rush or you're not. Lots of children, they're just built up with all this energy and they're running around everywhere. That doesn't mean that they are hyperactive. So you have to have, like I mentioned before, a select amount of these symptoms to be diagnosed with ADHD, and the doctor will really assess whether, maybe their behavior is appropriate for their age, or if there could be, they need to get a little bit deeper into it and figure out if they do have ADHD or not. So the symptoms have to be on the extreme side, and they have to cause problems in the child's life. Of course, the parents will notice these problems a little bit more, or teachers might notice them as well. So it's something to look into if you are finding that your child may be experiencing some of these symptoms. So they also, too, I forgot to mention before that they actually have to be doing this for at least 6 months. So if you are noticing that your child has a select amount of these symptoms and it's been going on for at least 6 months, then it's definitely something to go to your doctor about and talk about a diagnosis potentially. Now, let's talk about the treatment when it comes to children. The treatment plan, of course, will look different for everybody, but especially in children, okay? So some children will respond to medication differently than others. Some strategies in behavioral therapy will work better than others, of course. So treatment plans for ADHD in children, they usually involve some experimentation. And now I don't mean like we're just going to try to throw this and see if it works. Well, kind of, I guess. But don't worry, your doctor will advise you, of course, of the medications that should work to treat ADHD. But these medications might some will work different or better than others, right? So it might be a little bit of experimentation for a while. You might have to go through this phase of trying to figure out what works best for your child in the long run, because like I said, ADHD is not curable, and this is something that you are going to have to, or your child is going to have to learn how to deal with for their entire life. Now, the symptoms might get less severe as they grow up, but that also be because you really implemented a strong routine and that behavioral therapy into their life, so they're able to manage the symptoms a little bit more as they grow up. And it just changes throughout the course of your life. Sometimes you will have very strong symptoms of ADHD and others you might not, and events or other mental health conditions can kind of decide whether or will play a factor into how severe your symptoms are at that time. So medication. Well, the Centers for Disease Control and Prevention estimate that between 70 and 80% of children with ADHD who take a stimulant medication respond well to the treatment. But of course, there are going to be side effects to these medications. There could be facial or vocal tics, sleep problems, decreased appetite, dry mouth, mood changes with irritability. I think that the most common ones, because it's a stimulant, right, it's a high. So if your child does not take their medication at a good time in the morning and it is a strong enough dose to last them all day, they might have problems falling asleep, right? Because they're not producing, it's a high for them, right? And they're not producing enough melatonin to be able to fall asleep. So you want to make sure that you pay attention to these. Another very, very common is that decreased appetite. So if you find that your child is just not eating as much, just doesn't feel like eating, that's definitely a symptom of these stimulant medications. So that's kind of the basic for medication treatment. You have to kind of figure out what works best. And of course, it depends what type they have. If they're inattentive, they want that stimulant medication. Whereas if they are that hyperactive impulsive, you might be able to get away with a non-stimulant medication if you don't want your child to be taking that. But every treatment plan is different for every child. So now let's talk about behavioral therapy or behavioral intervention, like I mentioned. Basically, we really, really, really want to build a structure for a child with ADHD. Now, the strategies that you can learn in behavioral therapy can really increase the quality of life for your child and for you, because this will affect your life, your family's life as well when you have a child that struggles with ADHD. So these strategies will become daily habits and then therefore offer long-term benefits for everyone that is involved. So some of the things that you will learn in these behavioral therapy sessions, you'll learn things about time management, paying attention, task completion. And a really beneficial thing that you can do for your child that's struggling with ADHD is to just be very brief and clear when you're giving instructions. Long explanations can really confuse them because there's too much information for them to absorb and process, right? Remember, they have a hard time organizing new information or thoughts or just organizing in general. So making things very precise and just brief, clear to them is going to be the most effective. So be simple and straight to the point. You also want to plan for changes in the schedule as far in advance as possible. Kids with ADHD will find that their behavior worsens when there is all of a sudden a dramatic change in their scheduling. It can cause their symptoms to get worse. They can freak out. It causes that anxiety, that impulsive behavior. So if there are changes in the schedule, you want to make sure that you are warning your child far enough in advance. That's why it's also important that if your child is in school still, to make sure that their teachers, their helpers know at school that if there is going to be a change during, the school day, that the teachers can try to give that child as much notice as possible so that they are able to absorb and organize that information and they don't feel too off balance within their day. It's also really important to create an organized system so everything is in its place, whether that's their toys, the things that they put away, their coloring books, their crayons, all that kind of stuff. Having a very organized system is going to make it easier for them to function as well. You want to be consistent with your rules. You want to make sure that you are brief and straight to the point, but also consistent, because you don't want to be giving them all of this new information because it can confuse them as they're not able to organize those thoughts, those different rules, the things that you are implementing. You also want to limit choices when your child has to choose something. So say you are giving them an option of 3 different coloring books that they can pick from, or say you have 5 different ones, try to limit them as much so you can pick 1 or 2, or if you're reading a story at bedtime, don't give them an entire bookshelf to look at. Just pull out a couple books for them and say, do you want to read this one or this one? Because that's going to make it a lot easier and less stressful for that child. It's all about skill rehearsal as well. So making these skills a habit so that they are able to function every day on their own a lot easier. Consistency is key. Now, I think one of the most effective things that you can do for your child that's struggling with ADHD is to start a behavior chart. So this is going to help your child work toward a reward for good behavior. So basically a reward system is going to be really helpful for your child. So you can reward them when they have good behavior and then make sure that you implement consequences when they have bad behavior. And I think putting up a chart that's really organized as well. I was doing my research and I saw some parents did you get 3 stars, once you do these behaviors, and you get a star for your behavior or making sure things are organized or whatever it is. And then once you get 3 stars, you get a treat or whatever it is. And then once your child is aware of this a reward system, they're going to want to do it. It's a lot more helpful for them. And I think a chart just kind of adds to that as well, because it's adding in that organizational piece for them. They know that they can look at the chart and say, hey, I need 2 more stars this week to get a treat, or to be able to go to McDonald's on Friday and play in the play place, or whatever you want to do, right? So I think doing a behavior chart is really beneficial, but of course you're going to learn these things when you talk to your doctor or a therapist, or you do your behavioral therapy analysis of all of that. And really, ultimately, you just want to create positive experiences through activities that your child enjoys and does well in, right? We want to make sure that they are still doing all the positive things and not feeling too different than their peers as well, because when a child struggles with ADHD, they can feel very different from their classmates or fall behind, which I'm going to jump into in a second here, but you want to make sure that you're just creating those positive experiences for them so that they are, functioning in that reward system category and doing the proper behaviors, and then of course implementing those consequences when needed as well. Now, these are kind of general things, but also kind of mostly for inattentive type of ADHD. Now, I want to talk a little bit more about hyperactive impulsive type when it comes to children. So a child with hyperactive impulsive ADHD may not always show many signs of inattention, right? So they may not necessarily have trouble focusing, or they may not become easily distracted, but the treatments are relatively the same, except for, of course, those non-stimulant drugs are an option for the hyperactive impulsive type. And behavioral strategies will be a little bit different as well. Within your behavioral therapy, you're going to learn strategies that's going to help your child and you as well spot those impulsive behaviors and be able to spot them and then control their hyperactive and impulsive behaviors. So they also say too that some antidepressants can help as well, because drugs that affect mood can sometimes help with ADHD symptoms, but there are usually worse or more side effects that are common with these drugs, especially in children. So usually a combination of medicine and other treatments is the most common, but you're going to have to work with your doctor and figure out what is best for your child. Now, many kids have a combination of hyperactive, impulsive, inattentive ADHD, because that is the most common type of ADHD to be diagnosed. So you have to pay attention kind of to, they may display some symptoms and then and then not some, right? So you want to be specific with your diagnosis so that you can give them the proper treatment. And seeing a therapist or a counselor may also be very helpful for your child that experiences emotional difficulties because of this inattention issues or the hyperactive impulsive behaviors, because they might not be able to keep up with their classmates, right? And that may be causing them emotional distress that you might not be able to see either. But when they're feeling different or left out because they can't process the same information as their classmates, that can cause that sense of low self-worth and not feeling good about themselves and lead into spiraling into depression and anxiety and all those things. So you want to make sure that you are just doing what is best for your child, of course, and being specific with your diagnosis. Now, I want to say one more thing about ADHD within children, and that is ODD and ADHD, okay? So ODD, which is opposition defiant disorder, this is when your child or your teenager, whatever it is, shows a pattern of opposition towards you or an authority figure. So about 40% of children with ADHD develop ODD. So the behaviors may be kind of related to that hyperactivity or impulsivity of ADHD type, but it may also be how children cope with the frustration or the emotional stress from ADHD. So if some things to watch out to see if your child is developing ODD as well. Watch out for patterns of anger, irritability, outbursts, defiance. You just want to make sure that they are getting the help they need so they don't also develop ODD as well. And a child with ODD may also display and argue kind of like an argumentative personality or intentionally engage in annoying behaviors, like just to annoy you kind of thing. So behavioral therapy can also help treat the symptoms of ODD as well, but it's definitely something to watch out for if your child struggles with ADHD. Now, it's time for a break, but on the last stretch of today's episode, I'm going to talk about ADHD in adults. There is a lot of kind of differences that come into it, and I'm specifically going to talk about how ADHD is going to affect different parts of your life as an adult. So problems at school, problems at work, just life in general, problems within your relationships, because it can be very primitive in those aspects of your life. So I want to make sure I discuss all those for you, and of course round it off with ways that you can deal with ADHD as an adult and make sure you are functioning in your life to achieve optimized health and wellness. So still so much information to come for you. Don't go anywhere. I will be right back.
GSMC Beauty Tips Podcast gives you advice on everything from hair to fashion to skincare products. We'll talk about the latest trends in makeup, hairstyles, and anti-aging remedies. And we'll cover all of the newest fashion trends. If you have an interest in or questions about the beauty trends that might work best for you, the Golden State Media Concepts Beauty Tips Podcast has got you covered. Download the GSMC Beauty Tips Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back to the last stretch of today's episode of GSMC Health and Wellness Podcast. I am your host, Alyssa Jo. Now, today, this is the most exciting part for me of today's episode because I found it so interesting to research about ADHD in adults. So let me jump right back into it. Now, you might be a little bit surprised, but about 4% to 5% of adults have ADHD, and that's just because very few adults actually get diagnosed or treated for it. So who gets adult ADHD? Well, basically, like I've mentioned at the beginning of the episode, every adult who has ADHD had it as a child. Some may have been diagnosed and known it, but others may never have been diagnosed when they were young, and then they find out later on in life. So many kids with ADHD might outgrow it, but about 60% still have it as adults. And when I say outgrow it, there is no cure to it, but you are able to, your body will kind of function and develop over time and be able to function better with your ADHD symptoms, and you will develop a better routine and things where the symptoms are way less severe. But 60% of adults still have it as they grow up. So it actually seems to affect men and women equally in adults. But basically you can work, of course, together with your doctor and make a treatment plan that's perfect for you. So what are the symptoms of ADHD in adults? Well, as I've listed previously talking about the symptoms within the 3 types, they're all the same for adults as well. But you also might have some troubles with just following directions, remembering information, being able to concentrate, organize tasks, finishing work on time might be something that you struggle with. And these symptoms can be mild or severe, and they can change over time. An event in your life or your current mental state can also trigger your ADHD symptoms to become more severe again. But most adults with ADHD will also struggle with some or all of these things that I'm going to list at some point in their life. So anxiety, chronic boredom, chronic lateness and forgetfulness, depression, trouble concentrating when reading, trouble controlling anger, problems at work, impulsiveness, of course, low tolerance for frustration, low self-esteem, mood swings, poor organizational skills, procrastination, relationship problems, substance abuse or addiction, and low motivation. So these are very, very common with adults that struggle with ADHD. And you know, some of these may affect you, all of these may affect you, maybe none of them, but these are all going to kind of display in different aspects of your life. So you might see that you have some problems at school. If you're an adult with ADHD, you might have a history of not doing well in school and underachieving. You may have gotten in a lot of trouble. You may have had to repeat a grade because you weren't functioning as well or be able to focus to get that grade. You might have dropped out of school. There could be some problems at work, so you might change jobs a lot and perform poorly. You might just be less happy with your job and have fewer successes at work. Common ones in just life in general are getting more speeding tickets or having your license suspended or being involved in more crashes because, you know, it's that impulsive, hyperactive behaviors, right? You might smoke cigarettes, use alcohol or drugs more often, have less money just because of these problems you might develop at work. And they say that the psychological trouble like being depressed or having anxiety is very, very common. Now, what's also common is having relationship problems. So adults with ADHD are most likely to have more marital problems. They might get separated and divorced more often or have multiple marriages. So there are a lot of things, of course, as an adult with ADHD that you'll see in different aspects of your life compared to a child, of course, right? So these are things to watch out for, and it's crazy because you might have not been diagnosed when you're little, but then when you think back, you're like, oh yeah, I was like that in school, or I did function like that, or you might see just problems now in your relationships, or problems at work, or just life in general, where it's like, yeah, okay, maybe this is because I have ADHD. So how exactly is it diagnosed as an adult? So the doctor is going to probably ask you to get a physical exam to make sure there aren't any other medical problems causing these symptoms. You're probably going to get some blood taken from you to run some tests on that. They will recommend psychological testing as well. And then, of course, ask questions about your health history. Now, experts don't agree on an age that you can first diagnose ADHD, but they do agree that people don't suddenly develop it as an adult. So like I said, you would have had it as a child. So your doctor is probably going to look at maybe school report cards. They might look for comments about behaviors, problems, or poor focus, lack of effort, or underachievement compared to your potential, right? They might talk with your parents to see if you had any symptoms during your childhood, depending on how deep they're going to get with this diagnosis, right? So people who have ADHD, they're going to have trouble getting along with others sometimes as well, especially when they were kids, or they might have just had a hard time in school in general. Teachers may have had to work with you. Maybe you had to sit at the front of the class, right? So if any of these things are triggering your mind, you might think, I might have had ADHD when I was younger as well. So the treatment plans, of course, are all going to be specific for you and what's going to work best, but they include the medicine, therapy, education, just learning more about ADHD, and then, of course, getting family and friend support is going to be a part of your treatment plan as an adult as well. And I think that educating yourself as an adult on ADHD can be very effective in noticing your triggers and things that are setting you off, so then you're able to make those adjustments to fix them. And then once, of course, you know those triggers, or, once you're diagnosed later on in life, and after you start educating yourself, you're going to have these aha moments. Oh, I do that because of this. And then from there, you can make a plan that's going to work best for you. Now, medication is very common for adults, but some adults want to avoid medication altogether when it comes to this because stimulants as an adult can become very addictive. Now, it depends, of course, what type of ADHD you have, if you can do non-stimulant drugs or you need the stimulant ones, or maybe you just want to say no to the medication altogether and just opt for that behavioral therapy component of it. So cognitive and behavioral therapy can really help with your self-esteem because as you have ADHD as an adult, it is very, very common to have anxiety and depression and that low self-esteem that you might have not figured out why you had that before. So cognitive and behavioral therapy is beneficial for that. Relaxation training and stress management, these can lower those anxiety and stress levels, of course. Life coaching is also a really good option for an adult. It may help you set those goals. It can also help you learn new ways to stay organized at home and work, just in every aspect of your life. Job coaching or mentoring can be very beneficial. So this can help support you at work. It can help you have better working relationships and improve those on-the-job performance that you need to make sure that you are able to function at your job. And then, of course, family education and therapy is very beneficial as well. So this can help you and your loved ones really understand ADHD better. It can also help you all find ways to lessen how much it affects everybody's life that is involved. Now, making sure you get fully checked by a doctor is important because people with ADHD often face these other conditions like I've mentioned before, right? And you may also have a learning disability. You may have anxiety or another mood disorder. You might have obsessive compulsive disorder or a dependence on drugs and alcohol. And so knowing the full picture can make sure, of course, you're going to get the right treatment plan for you. And of course, no two people with ADHD are exactly alike. So if you have ADHD, you may be able to concentrate if you're interested in or you're excited about what you're doing. But then on other things, you may not be able to concentrate because you're just not as excited about them. But some people with ADHD have trouble focusing under any circumstances at all, where others may look for stimulations and others try to avoid it. So it's really just kind of what is going to work best for you. But another thing that's common in adults with ADHD is being withdrawn and antisocial. You might not really want to socialize with people. It might just be withdrawing in social settings completely, while others can be very social and go from one relationship to the next, which is that hyperactive, impulsive behavior that you might be displaying. So it just depends on the person is really what it comes down to. Now, I want to round off today with some things that you can do to improve any of these symptoms, whether you're getting a diagnosis or not. I just find that these are very helpful if you are displaying maybe just a couple of these symptoms, or maybe you're displaying all of them. It doesn't matter. These are just some kind of general things that you can do to improve your quality of life if you are struggling with these. So the first one is to organize. Choose a time that's quiet, and maybe it's at night before you go to bed, and just plan out your next day. Write down each task that you have to do. Make a realistic list of the things that you need to complete, and I emphasize realistic. Alternate things that you want to do with the ones you don't want to help your mind kind of stay engaged. Using a daily planner or a reminder app, a timer, leaving notes for yourself is very beneficial. Set an alarm clock when you need to remember for an appointment or an activity, just making sure you're staying organized. Be realistic about your time as well. Your brain is wired differently than other people's if you're struggling with ADHD, so it may take you longer to get things done, which is totally normal and totally okay. You just got to figure out a realistic time frame for your daily tasks that you need to do, and don't forget to build in time for those breaks if you think that you're going to need them. So be good with your time management. Breathing slowly is very beneficial, of course. If you tend to do things that you later regret, such as, you interrupt others, or you get angry, or maybe you just you're impulsive that way, managing those impulsive behaviors by pausing, counting to 10, breathing slowly, instead of acting out right away is really beneficial for those impulsive behaviors. I know that's easier said than done, but it's something to practice and get into a daily habit of if you find yourself being impulsive. Cut down on those distractions. So when it's time to buckle down, put your phone out of your room, put any TV, radio, don't leave anything on, just focus at your task at hand. And I think the easiest way to do that is just to completely remove distractions in front of you. Make sure your phone's not dinging, ringing in another room. Just put everything on silent and be able to focus on what's in front of you. Controlling clutter is another way to quiet your brain and just to kind of clear your space of things that you don't need, because our emotions and our behaviors are so strongly tied to our environment. So if you are in a messy environment, your brain is actually thinking about that, even if you don't think you are. So make sure that everything is decluttered, cleaned, and organized so that you are able to focus on just your task at hand, and there's not something going on in the back of your mind thinking, I got to do the dishes later, I got to, pick up the clothes off the floor, whatever that case is. Another thing that's very beneficial is you got to burn off that extra energy that you may have. So exercise is good for everyone, but it can really improve how you function in your everyday life if you struggle with ADHD. Just getting that little bit of exercise can ease those ADHD symptoms. I think starting out in the morning, even with just 20 minutes of movement, can get out that anxiety, that extra just kind of hyperactivity that you need out of your system so that you are able to focus better. Learning to say no. Okay, this is another really important one. Impulsive behavior can be a side effect of having ADHD, as we talked about, and this means that your brain might bite off more than it can handle. So if you find yourself very overwhelmed, try to say no to a few things. Don't put as much things on your plate. Just ask yourself, can I really get this done? Be honest with yourself and with others about what's possible so that you're not overwhelming yourself. That reward system is really important as well. As an adult, reward yourself when you get things done. When you stick to a task, it can be a lot easier when you have a reward coming later on. So use that reward system. Do a chart for yourself if you like that. It's really beneficial to have that reward system. And then lastly, which is of course very, very important, is just to ask for help. We all need help from time to time. It's nothing to be ashamed of, and it's very important to just not be afraid to ask for it. If you are having these disruptive thoughts or behaviors, talk to a counselor, talk to a friend, talk to a therapist, talk to family members, talk to somebody and see if they have any ideas and ways that they can help you during this difficult time. So there you have it. Those are all the other things that you can do. And I just want to say that, when you properly treat your ADHD, you can showcase your intelligence, your talents, your interests, and you can shine. It's not something that has to weigh down on your life. Once you get that proper treatment for you, you can still thrive and be the best version of you possible, even better than you probably imagined if you never realized you might have had ADHD beforehand. So don't let it kind of tear you down. Just find what works best for you, build a lifestyle around those things, and you can shine as bright as ever. All right, well, that is today's episode. Thank you so much for listening to GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I am your host, Alyssa Jo. I had so much fun sharing this information with you guys today. I hope you enjoyed it. Don't forget to head over to our social media pages. We got Twitter, Facebook, and Instagram. If you want to interact or ask me a question or just talk about something that I mentioned throughout today's episode, definitely shoot me a message on one of those platforms. I would love to chat with you. And don't forget to leave a 5-star review because it helps out a ton, and I love reading these reviews. So once again, thank you so much for listening to today's episode. I am your host, Alyssa Jo, and I look forward to sharing more information with you next time. Thank you.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network. From movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.